I welcome you on board. This is Engaged with Wookie, and today I will be talking about fibroids in African women. This is a condition that has plagued women from time immemorial. A lot of women have even died from it. Some people have suffered infertility because of this condition, and I think we need to talk about it. People need to know what these things are, what are their risk factors, how to go about it. So sit back and let us dive into the topic fully. Okay, guys, so what are fibroids? Fibroids are non-cancerous growths made of muscle and fibrous tissue that develop from in and around the woman's uterus. Yes. So somebody will say, oh, is it cancer? No. Most fibroids are benign. They're not malignant in nature. Well, 1 in 1,000 according to studies. That's why it's good to check. Maybe cancerous. You may be dealing with something else and you're calling it fibroid and you do not know. That is why it's good to seek medical intervention and seek medical intervention early. Very, very, very important, guys. So these things affect women, especially women of reproductive, age. And the varying sizes. And talking from my own experience, mine, they were very big. I had one like the size of a pawpaw, like the size of a big orange, a pea-sized fibroid. It was just in like various sizes. And in my case, it seemed like a 6 to 7 months pregnancy. Yes, it was that bad. That if I laid on my belly, it would feel as though I laid on a stone. Very uncomfortable, and people around me thought I was pregnant. So, to answer the question in your heart, they're non-cancerous, mostly benign in nature, and they grow in and around the womb or the uterus of a woman, a young girl. I remember mine even started before I got married. Way before I got married, we discovered. I think I was a teenager when they discovered that I had fibroids. Yes. So that's what fibroid is. Risk factors. What are those things that predispose women to fibroids? Number one, age. Studies say like 30 to 50, but because of several other factors, younger women are getting this condition. Like I got it when I was a teenager. So, but studies say somehow, based on my little research, 30 to 50. They get it. And then ethnicity, race, people and women of black descent, Africans generally, are prone to having fibroids. It's very common among African women. And then other risk factors would be, this is a very, very strong one because of our skin. Vitamin D deficiency, low levels of vitamin D, yes, predisposes women to developing fibroids. And also dietary factors and environmental factors, consuming too much of red meat. A huge one also is family history. So sometimes if your mom has it, there is that tendency that you're gonna get it. So it runs in certain families. So these And more, if you can search, look up, or ask your doctor provider, they can tell you more. But these are major ways through which people are predisposed to developing fibroids, uterine fibroids. So it's getting kind of more serious here, more interesting. We have different types of fibroids, and fibroids are typed by their locations. If you look at my slide, I listed it there. The most common one is the intramural. That one is very common, and I think that's the one I had. For me, I experienced spotting, I experienced heavy menstrual cycle, like bleeding, and then I experienced a lot of blood clots. So they're all dangerous, but based on location, some could be more, clinically problematic. Like I think it's a submucosal one. This one grows into the uterine cavity and it causes very heavy bleeding in women. This was the type somebody very close to me had. And she was losing blood heavily, bleeding heavily, pouring. And then this person had to go for total hysterectomy. I'm going to get to that, but I'm still talking about types. So you see why you need to get yourself checked out. So you don't say, oh, it's just fibroid. Oh, there is an herb that I'm not talking against herbs. I'm not talking against any non-pharmacological, intervention that you may want to explore. But I am just saying, please do seek proper medical intervention. Talking from things I have seen people do, and how people have, made a mess of themselves by not seeking proper medical intervention and at the right time. So these things are typed by their location. It could grow inside, it could grow outside, and it could just be attached by a stalk inside or outside the uterus. So it's very important, if you think you have fibroids, to get yourself checked out and know what you're dealing with. And from there, sometimes doctors will just leave it. If it's not problematic, it doesn't seem like it's going to be a problem. And I think people carry pregnancies to term with fibroids sometimes. And sometimes just on their own, they will shrink. Yeah, now I'm getting ahead of myself because I have this in other slides that I'm going to talk about. I'm just talking about the types here. So look at my slides and check out, the types of fibroids that, people have. So if you look at the image projected on the slide, you will see fibroids typed by location, different types of fibroids based on their location. I got this from Google. You can also, dive in Google, make a search and read up and be informed. This is what this slide is all about, just to show you how those things are implanted in and around the uterus of a woman. So how do you know that you have fibroids? As a woman, you have to be very sensitive. Very, very, very sensitive. Pay attention to yourself. Pay attention to your body. Your body speaks. Your body is talking to you. You need to listen. You need to listen. Don't ignore the signs, the symptoms if you have them. At the least, just, take yourself to the hospital, get it checked out. If it comes to nothing, you've done very, very well by going to check, because time is ticking and it is of essence. Very, very important. Anything caught early is easier to deal with, it's easier to manipulate, it's easier to stop, it's easier to cut. When things are discovered late, that's when we have problems. So, as a woman, I've listed here, and there could be more. You can dive into Google and do a search. If there are more symptoms, more signs, you just realize that your tummy is getting bigger and bigger. You are not pregnant. What is going on? That was what happened to me. I told you it was like I was 6 to 7 months pregnant. You're having heavy menstrual flow with very bad, very huge blood clots. You need to get yourself checked out. Anemia, blood loss, pelvic pain or pressure. You're not getting pregnant. What is going on? Pain during sexual intercourse. Prolonged menstruation. If you are having any of these symptoms, please get yourself checked out. If your daughter is having any of the symptoms, take your daughter to the hospital. Let her get checked out. This is where mother to daughter relationship is very, very crucial. I told you mine started when I was a teenager. My mother took me to the hospital. We saw a gynecologist and we knew what we were dealing with. And when it was time for it to be dealt with, we dealt with it. But we knew quite on time. Very, 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 very important. You have teenage girls in the house, watch their menstrual cycle, pay attention to their flow, ask questions, give them that opportunity to talk to you about how to feel in their body, what is going on with them. Do wellness check. Just take them to the hospital and just let the doctor check them out. Especially in this time and age. Very, very, very important, guys. Do not ignore any of the signs. Very, 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 very important. Yeah, it is. Okay, so how is fibroids diagnosed? It's by, palpating, and not all fibroids are palpable. Mine was palpable. They could feel it. I could feel that I had some things in there. But there are ones, like the submucosal one, I don't think is palpable because of the location. So even if it's palpable, you still need to go for these exams listed on here. Usually they start with an ultrasound. They do pelvic exam. They do MRI for detailed mapping, imaging. And they also do, minimally invasive procedures like hysteroscopy to diagnose and sometimes to remove. Because this particular one causes infertility a lot, miscarriages a lot. Women getting pregnant, having miscarriages, and some not even getting pregnant at all. So these are ways that doctors can, diagnose you properly for having fibroids. Okay, moving on. I'm actually really very excited. I'm sharing this knowledge with you guys. And I pray this helps somebody out there. And if this has helped you in any way, please go ahead and share the slides with somebody. Just share it with somebody, right? You may be saving a life. Okay, treatment options. This can be very, 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 sensitive. This is very sensitive. Yes, this part is very sensitive. And I will tell you why. But first and foremost, let me talk about no treatment option. That's the number one treatment option. Doctors don't want to do anything about it because this patient is asymptomatic. They're not feeling anything, no negative thing happening, going on in their bodies. They're getting pregnant, they're carrying pregnancies to term, but they're closely monitoring these fibroids. But doctors have just decided, okay, let the sleeping dog lie. Let's not just disturb it. And then sometimes they just shrink on their own. Probably after menopause or something, they just go away. No treatment option. Number one treatment option. And number two on my slides, hormonal therapy. Number three, GnRH. Number four, we have myomectomy. Yeah. I can't remember. That was the very first surgery I had. Myomectomy. They go in there and they extract, they excise. I think that's the right word. That's the right medical term. They excise those fibroids, bring them out. This is to allow the patient to get pregnant. It allows fertility. They don't just bring those things out. Remember, we said when I started this presentation that although fibroids mostly are non-cancerous, but sometimes less than 1% or 1 in 1,000, they bring out this tumor, they bring out this thing, and they send it to histology. They do a biopsy and they discover that, oh, this is a malignant growth. So for that purpose, we don't just take out fibroids. We take them out and we put them to test to be sure if they're malignant or not. Very, 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 very important, guys. This is why when you go to the hospital, go from the point of information. Don't just go and take in everything hook, line, and sinker that the medical practitioner is telling you. Ask questions, especially my African women living in African world. Please, I beg of you, when you go to that operating room, before you go with your mind set, aware, knowing what condition you are dealing with. Go with questions in your heart during consultations. Dive in, dissect the matter, ask all the necessary questions, and peradventure, you notice this provider doesn't have the capacity to do this. It's time to seek medical intervention somewhere else. I am telling you, I don't want to start telling you experiences of people, or maybe I should tell you. I remember there was a lady, they took it out, and they thought it was just fibroids, non-cancerous, benign growth. They took it out, and then 3 months down the line, everywhere was messed up. It already spread it to other parts of the body. It was cancer they took out. They did not do proper check. And within 3 to 6 months, this woman died. It was really a sad and a bad case. There's one experience I'm telling you. There is another one. Up till now, she was so messed up that she still does not have children of her own. And she's done everything possible. She's seeking she's trying to look into surrogacy, because she already tried IVF. It didn't work because she was really messed up medically. So what am I telling you? Don't just go to the hospital blank. Read upon your pregnancy. Read upon your condition, whatever it is. Today we're talking about fibroids. Read up. so you have the right questions for your provider. And if you think they're not capable, please, it's time to go get a secondary opinion about the issue. Very, very important, guys. So myomectomy is another treatment option, and this allows, fertility. The most sensitive one, the most sensitive option, and it's sensitive because if we're dealing with a patient who doesn't have children, how do you face this patient and tell this patient that this is a bad case, we have to take out your womb? And I remember when I did mine over 15 years ago, let's say like it's over 17 years ago precisely, my gynecologist looked me in the face and told me, Madam, if I get into that operating room and I see that this is beyond excision, this is just beyond excising, if I get to that point whereby I have to choose your life over this part of your body, then I have to take this part of your body out, which is hysterectomy. I cannot tell you how I felt right now. I felt bad, of course, but it was way more than feeling bad. Do you know what that means? I didn't have any child then. I thought about it for a second and I decided to pray about it. It's history today. But I was also at that point where they suggested this to me. So this is why we need to seek help quickly and on time. That's a very sensitive one out there. I remember a couple of months back, my friend called me and told me a friend of hers went to the hospital. She was having this and that symptom. And the doctor, after all the tests, MRI, CT scan, everything, they're telling her, I am sorry, we have to do a total hysterectomy. She's not even married. She doesn't have children. And then now doctors are saying, forget about children. We're trying to save your life. It can be that bad. But my prayer is that that will not be a portion. Okay, guys. So that is this about the slides. You can read up online, talk to your provider if you're going through this, and see what option best suits your case. So it depends on patient's goal, it depends on the size, and it depends on medical comorbidity rather. Pardon me. So I'm not gonna delete this slide because of that mistake. Yeah. So sometimes people have other medical conditions that they're going through, and then doctors have to weigh options. Okay, the specialist this, the specialist that. What can we do to help this patient? Let's just take this out. So sometimes, because sometimes patients are dealing with multiple diagnoses, and then let's just do it and save this person's life. So, what women go through. So when they ask you, what do you bring to the table? You know what to answer. That's just in a lighter mode. Let's continue. So it is time to fly and not just run when you're having any of this. Severe bleeding, dizziness and fainting. Oh my God. Sudden and progressive abdominal distension. It's time to fly. It's time to go to the operating room. So finally, guys, this is the last slide, and this is going to be my advice to you as a woman, as a girl, as a teenager. And I am very grateful that, to God that I was able to come up and do this. And I'm very grateful for you if you're able to use this information and use it very well for yourself and people around you. So this is my advice. Well, woman exam. Your wellness exam is very crucial. Do not joke with it. And it starts from being very sensitive and paying attention to your body. Your body is very important. Treat your body very well. You see something, say something. Don't just see it and go quiet about it until it becomes something big, and then you remember, 5 months ago, I noticed this. The moment you notice anything about any part of your body, woman, go seek medical advice, intervention, get diagnosed, at least know what is going on. Healthy weight. Let's watch our weight. Very important, because obesity is one of those things that also, predisposes people to having fibroids. I forgot to mention that in my slide, but it is definitely, like I said, I may not have mentioned everything, I may not have said everything, but you can Google, you can read up, you can ask your provider, you can talk to your nurse practitioners about these issues. Eating very good, balanced diet, very, very good for you as a woman. You need to get your vitamin D sorted out. I'm telling you, a lot of black people in general are deficient, seriously deficient when it comes to vitamin D. I was at that point. Because of our dark skin. It's very important that you take your vitamin D supplements very well. Work-life balance, stress. Don't stress. We know life is very stressful, but know when to stop, know when to take a break, know when to sleep. Sleep is very, very important. Ensure you get adequate sleep, at least 8 hours a day. Very, very important. And I'm talking to myself as well. I know I am talking to myself. Shun very, very highly processed foods. Very, very, very important. Consume more of fresh foods. Processed foods is a no, 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 no. And on a final note, listen to your body. I started with that, I'm ending with that. Listen to your body, ladies. Pay attention to yourself and seek medical intervention very, very early. I want to say a very big thank you to you for taking time out to go through my slides, to listen to me. I'm grateful. Thank you so much. And if this has helped you in any way, in any little way, if you've gained anything, just kindly click on the share button and share with a woman, with a lady, with a young girl that you know will definitely benefit from this lecture. God bless you. Until I see you again, my name is Buki, and this has been Engage with Buki. We talked about fibroids today, so some other time I'm going to talk about something else. I don't know what it is. And if there is anything you want me to talk about, you can put it right in the comment section, and then we will come and talk about it. God bless you, and have a very wonderful rest of your morning, afternoon, and night, depending on when and where you're seeing this. Goodbye. Thank you for watching.